Hey everyone, and welcome back to the Deep Dive. Today we're plunging into a topic that might genuinely surprise you with its sheer prevalence: swine gastric ulceration.
Yeah, it's quite something.
Let's kick things off with a fact that just might make your jaw drop. Up to 90% of seemingly healthy pigs at slaughter show some degree of stomach damage.
90%. It's staggering.
And as many as 25%, a quarter, have severe clinically relevant ulcers.
It's true. And what's fascinating here is just how pervasive and, well, often hidden this issue truly is within modern pig farming.
Right.
Our mission today is to give you a clear, comprehensive understanding of why this is such a widespread problem, what it costs the industry, and maybe most importantly, how we can prevent it.
Okay.
We've sort of distilled the most important nuggets from a stack of sources, everything from detailed pathology reports to, comprehensive control strategies so you get the full picture without the overwhelm.
And we'll show you how factors you might not immediately connect, like feed processing, general stress, even genetics, they play a massive role.
Absolutely.
This isn't just about pigs. It's a really compelling case study in how intensive production practices, designed with efficiency in mind, can unintentionally create these widespread health challenges. It truly forces us to reevaluate what efficiency truly means in the long run.
Exactly. It's a bigger picture thing.
Before we dive deeper into the root causes, perhaps we should set the stage for exactly what we mean when we talk about these ulcers.
Good idea.
We're specifically referring to gastroesophageal ulceration, or GEU, which affects a very particular region of the pig's stomach called the pars esophagi.
That specific spot, yeah.
This area is right near where the esophagus enters the stomach, and it's a huge, economically significant issue in modern swine production.
You're right to highlight that specific area, the pars esophaga. While gastric ulcers in pigs were first reported way back in 1897, their prevalence really exploded after the 1950s.
Wow, okay, since the 50s.
Yeah, and this isn't a coincidence. It directly correlates with the intensification of pork production, think high-energy diets, and critically, finely processed feeds.
The feed.
Post-mortem surveys consistently show that striking 80% to 90% of pigs at slaughter have some form of pars esophageal damage.
80 to 90%.
And about a quarter of those stomachs show severe, actively bleeding ulcers. That's a massive problem hiding in plain sight.
Those prevalence numbers are truly alarming. But beyond the immediate deaths, which are obviously tragic, what are the hidden economic drains? These subclinical ulcers that producers might not even be realizing on a day-to-day basis.
That's a crucial question. The most dramatic loss, of course, is sudden death from acute hemorrhage.
Right.
We're talking about pigs that were otherwise healthy, often the fastest growing ones nearing market weight.
The best ones? Often.
Exactly. On some farms, if infectious diseases are well controlled, gastric ulcers can sadly become the leading cause of mortality in grower-finisher pigs. We're talking endemic rates of maybe 1–2%, sometimes much higher in outbreaks.
1 to 2% loss just from this.
But you're absolutely right. The hidden costs are significant. The subclinical ulcers, the ones you don't even see, cause losses through reduced feed intake, poorer feed conversion, and decreased average daily gain.
How much are we talking?
Sources indicate these subtle losses can reach up to 200 grams per day in severely affected animals.
200 grams a day. Multiplied across thousands of pigs, that really adds up.
It really does. And beyond the economics, from a welfare perspective, it's a source of considerable pain and discomfort for the animals.
Yeah, you have to think about that.
Clinically affected pigs can show behaviors like teeth grinding, listlessness, clearly indicating their distress. It makes you wonder, how do we balance that push for efficiency with the well-being of the animal?
And to understand that balance, we need to dive into the pig's unique anatomy, because it really sets the stage for where these ulcers occur.
It's key.
The pars esophagia. It's lined by this white, non-glandular, stratified squamous epithelium. It's essentially an extension of the esophageal lining.
Like the throat lining, basically.
Yeah. And this is the critical part. Unlike other glandular regions of the stomach, this specific area does not secrete mucus and completely lacks that protective barrier.
No protection.
So it's inherently vulnerable to chemical injury.
That's the crux of it. The mechanism of ulcer formation is fundamentally a breakdown of this normal protection. In a healthy pig, a semi-solid mat of feed typically sits in the upper stomach, maintaining a relatively neutral pH.
Okay, like a cap.
Exactly, like a physical cap. This physical mat separates the sensitive pars esophagia from the highly acidic fluid, which is typically pH 1–2.
Very acidic.
Very acidic. And the digestive enzymes like pepsin found in the lower stomach. Ulceration really begins when this protective stratification, this layering, breaks down.
So if you have finely ground feed or if the pig's stomach is empty, say from feed withdrawal,
Hmm.
the stomach contents become much more fluid, like soup instead of stew.
Good analogy, yeah.
Yeah.
This allows corrosive acid, pepsin, and even regurgitated bile acids to slosh around and directly contact that unprotected pars esophageal.
And this is a key distinction from human ulcers, by the way. Most human ulcers are often infectious, caused by H. pylori.
Right, bacteria.
Swine ulcers, however, are primarily a physical and chemical injury directly driven by how we manage their production.
That's a critical point for management strategies.
Mhm.
This understanding completely reorients our focus for prevention. It moves us away from thinking about antimicrobials
Right, it's not about antibiotics.
and instead zeroes in on managing feed and feeding practices, which are the fundamental causes of this physiological imbalance. It's a systems-level problem, not just a bug to be killed.
Given that this progressive damage in the stomach can be objectively assessed using a staging system, which sounds super helpful for vets and producers.
It really is.
So walk us through the stages of ulcer development. Stage 0 sounds pretty straightforward. Normal, smooth, white, glistening.
That's right, nothing to see there. Then, if that initial irritation isn't resolved, it can progress to stage 1, hyperkeratosis or perikeratosis.
Okay, what's that look like?
This is the initial pre-ulcerative stage. It's a protective response to mild irritation, where the epithelium becomes thickened, rough, and often takes on a yellow stain from bile.
Ah.
While subclinical, meaning you might not see outward signs, it's a clear warning sign, indicating risk of progression, like a callus forming.
Gotcha. So if that thickening continues, what happens next?
With continued insult, that thickened epithelial layer starts to crack and fissure. This is stage 2. Erosions, marking the onset of active tissue destruction.
So actual breaks in the surface?
Exactly.
Hmm.
If a producer or vet sees this consistently in postmortem checks, it's a clear indication that the problem is advancing and needs attention.
And then the really serious stuff.
Precisely. Stage 3 is ulceration. These are deep, crater-like defects. They can penetrate deep enough to erode blood vessels,
Oh, wow.
leading to chronic bleeding and anemia. You'll see pale pigs or dramatically acute, massive hemorrhage, which results in sudden death.
That's the sudden death scenario.
That's the one.
And the final stage we might see when an ulcer heals is stage 4, scarring or stricture.
Yes. This is when ulcers have healed, leaving behind characteristic star-shaped scars. But sometimes, severe scarring can actually narrow the esophageal opening.
Constrict it.
Yeah, causing problems like vomiting undigested feed immediately after meals and, consequently, severe weight loss. This staging system isn't just academic. It's a vital diagnostic tool.
How so?
Imagine a producer doing a routine post-mortem on a few market hogs and consistently finding stage 2 or 3 lesions. That's an immediate red flag.
Right.
It tells them something fundamental in their feed management or stress protocols needs urgent review, long before they see actual deaths or obvious illness. It provides an early warning system.
That makes sense. So why do ulcers happen? As we've hinted, it's not just one thing. It's a complex web of factors that disrupt the stomach's normal environment.
It is. It's truly a multifactorial etiology. The most critical factors are nutritional, and within that, feed particle size is arguably the single most important.
Particle size.
Studies show a strong correlation between finely ground feed, especially below 700 microns, and higher ulcer incidence.
Below 700. Why is fine bad?
Fine particles create that fluid-like digesta we talked about, preventing that protective feed mat from forming and exposing the pars esophageal to acid.
Ah, so the cap doesn't form properly.
Exactly. This creates a paradox for producers.
Hmm.
Finer grinding often improves feed efficiency, but dramatically increases ulcer risk.
It's a classic example of the law of unintended consequences, isn't it? You aim for efficiency, but it creates this hidden cost.
It absolutely is.
What does that mean for a producer's bottom line? Are we talking about small tweaks or a complete recalculation of what efficiency truly looks like?
It's a critical financial decision point. Studies have shown the hidden costs of gastric ulceration, the lost weight gain, the increased mortality can easily negate or even far exceed the perceived gains from finer feed.
Wow.
It forces a complete recalculation of what efficiency truly means in the long run. Pelleting and heat treatment are also strongly linked to increased risk.
Pelleting too. Interesting.
Yeah, while coarser meal or liquid feeding systems are associated with lower prevalence. And it's not just how the feed is prepared. What's in the feed matters too.
Like the ingredients.
Definitely. Low-fiber diets are a major risk factor because they reduce saliva production and the formation of that stable feed mat. Coarse fiber, like straw or wheat bran, is protective.
So fiber helps build that protective layer.
Precisely.
And are there specific diet compositions that increase risk besides low fiber?
Yes. High-energy, low-protein diets and those high in rapidly fermentable carbohydrates like wheat or cornstarch are also implicated. Think diets designed for maximum rapid growth.
Okay.
And micronutrient deficiencies also play a part. For instance, low levels of antioxidants like vitamin E or selenium can compromise the integrity of the stomach lining, making it more susceptible to damage.
Right. Basic cell health.
Exactly. Similarly, imbalances like too much copper relative to zinc can affect tissue repair and overall gastric health.
Fascinating. Beyond nutrition, it sounds like management and environmental stressors play a huge part. You mentioned out-of-feed events earlier. How significant are those in triggering ulcers?
Hugely significant.
And how do they connect some of these seemingly disparate risk factors?
That's a great point. Out-of-feed events, any interruption in feed availability are a potent trigger. An empty stomach leaves the esophageal completely exposed to acid.
So consistency is key. What happens if, say, a feeder malfunctions overnight and pigs go a few hours without feed? Is that enough to trigger a problem?
Absolutely, it can be, even relatively short periods. And that factor, the empty stomach, connects many seemingly disparate risk factors.
Like stress.
Exactly. Stress itself, whether from transportation, high stocking densities, social stress from mixing pigs, or even poor stockmanship, can all disrupt feeding patterns and lead to those crucial fasting periods.
Makes sense. Pigs get stressed, they don't eat as much or as consistently.
Correct. Even the thermal environment plays a role. Hot weather reduces feed intake, causing inconsistent consumption and empty stomachs, which amplifies ulcer risk.
In genetics?
We also see a genetic predisposition,
Yeah.
There's a higher incidence in certain high lean genetic lines and also in barrows compared to gilts.
Interesting. You know, when people hear ulcers, especially in humans, they often think of things like H. pylori. So it's natural to wonder about infectious agents in pigs. Helicobacter sus often comes up. What's its actual role here? Is it a primary culprit or something more nuanced?
That's a very common question,
They-
and it's an important distinction to make. Helicobacter sus is frequently found in pigs and is associated with gastric lesions. However, it colonizes the glandular regions of the stomach, not the pars esophageal, where these specific ulcers form.
Different location.
Right. Its role is likely indirect, causing chronic gastritis and potentially altering acid secretion, thereby worsening conditions for ulceration in that vulnerable part of the esophageal. It makes a bad situation worse, perhaps, but it's not the primary driver.
So not a direct cause like H. pylori in humans, which means, again, antimicrobials aren't the primary solution here.
Exactly. Focus needs to be elsewhere.
And what about concurrent diseases like swine influenza? Do they directly cause ulcers or do they contribute in another way?
They absolutely increase ulcer mortality, but primarily because the accompanying anorexia, the loss of appetite due to illness, leads to fasting.
Back to the empty stomach again.
Back to the empty stomach. And as we've discussed, fasting is a powerful trigger for acute ulceration. So while not a direct cause of the initial lesion, systemic diseases can certainly push things over the edge and cause death from existing, maybe subclinical ulcers.
Okay, that makes sense. So if these ulcers are so common, how do you spot them in a live pig? Or maybe more commonly, how are they diagnosed?
A major challenge is that most cases are subclinical. You often only see subtle signs like reduced weight gain or poor feed conversion efficiency, things easily missed or blamed on something else.
Right, the poor doers.
Exactly. In chronic cases, you might notice signs of progressive anemia. Pigs look pale, weak, lethargic, or generally unthrifty. A key sign, if present, is black, tarry feces, which is digested blood. Melena.
Black, tarry feces. Got it.
It's important to note that diarrhea is not typically a sign of gastric ulcers. That points elsewhere.
Okay, good distinction. And for those most dramatic cases you mentioned, the sudden deaths.
That's the peracute presentation. Sudden death of an otherwise healthy-looking pig due to massive hemorrhage. When you open them up, the carcasses are strikingly pale, almost white.
Just bled out internally.
Essentially, yes. In rare chronic cases where there's severe scarring, you might see esophageal stricture, with pigs vomiting undigested feed immediately after meals and showing severe weight loss. But that's less common.
The definitive diagnosis, though, is usually made during a systematic necropsy, which means examining the animal after death.
That's correct. That's where you really see what's going on. You'll often find a very pale carcass. Upon opening the stomach, it might be filled with a large, dark blood clot. And the intestines will contain dark, tar-like digested blood. The key is a careful visual inspection of the pars esophageal for those characteristic lesions we described, using that staging system from thickened areas to deep, crater-like ulcers.
Can you use abattoirs, slaughterhouses for monitoring?
Absolutely. Abattoir monitoring is a valuable tool for herd assessment, though it's important to note that fasting during transport can induce or worsen lesions.
Ah, so it might inflate the numbers slightly.
It potentially could, yeah. So you need to interpret those findings carefully, but it still gives you a good snapshot of herd health over time.
And you have to rule out other causes of sudden death or pallor, right? Things like intestinal volvulus, which is a twisted gut,
Twisted.
or proliferative hemorrhagic enteropathy, also known as ileitis.
Absolutely. A good differential diagnosis is crucial to ensure you're addressing the right problem. You don't want to chase ulcers if it's actually ulceratus or vice versa.
So what does this all mean for solving the problem? It really sounds like prevention is absolutely paramount here because treatments for commercial herds just aren't economically viable.
You've hit on the core strategy. Really, due to the subclinical nature and the cost of individual treatment, prevention is the only practical and sustainable approach for most producers.
Okay, so where do we start with prevention?
And the cornerstone is nutritional and feed management. That's number one. Optimizing feed particle size is the primary intervention.
Back to the 700 microns.
Back to the 700 microns. We need to maintain an average particle size greater than 750 microns. Roller mills are generally preferable to hammer mills for a more uniform grind, less dust.
Let's find particles.
Exactly. And transitioning from pelleted to meal feed can significantly reduce risk, although that has other implications for feed handling and wastage.
Trade-offs again.
Always trade-offs.
So getting that coarse fiber in there is key for making a stable feed mat in the stomach. And we also need to avoid excessive fermentable carbohydrates and make sure micronutrients like vitamin E, selenium, and zinc are well balanced.
Exactly right. Dietary formulation is critical. Beyond feed composition, husbandry and environmental controls are vital.
Like the out-of-feed events.
Eliminating out-of-feed events is paramount. This means diligent feeder management, making sure there's adequate feeder space so all pigs can eat, and promptly addressing any disease outbreaks that cause anorexia.
Because sick pigs don't eat.
Sick pigs don't eat, and remember, an empty stomach is a potent trigger.
It's fascinating how all these factors intertwine. Minimizing stress, whether it's from transportation, high stocking densities, social dynamics from mixing, is crucial.
It all plays a part.
And in hot weather, effective cooling is essential to encourage consistent eating, preventing those periods of an empty stomach. It's truly a holistic approach, isn't it?
It really is. You can't just fix one thing. As for therapeutic interventions, they exist, but they are limited in commercial settings.
Like medicines.
Yeah, acid-suppressing drugs like omeprazole or H2 receptor antagonists or cytoprotective agents like sucralfate. These can be effective for high-value individual animals like breeding stock or maybe pets.
But for a large commercial operation, the practicality just isn't there.
Not really. These treatments are simply cost-prohibitive for large herds. So again, prevention is the only economically viable path that has to be built into the system.
So to recap our deep dive into swine gastric ulceration, this is a quintessential production disease. It directly results from the very nutritional and management strategies designed to maximize growth and efficiency in modern pig farming.
That sums it up well.
Its high prevalence and significant impact truly underscore the need for a proactive, prevention-focused approach.
The key takeaway is clear. The core issue comes down to two things: feed that's too finely ground and interruptions in feed intake.
The particle size and the empty stomach.
Exactly. Both of these lead to the exposure of the unprotected pars esophageal to corrosive stomach contents. Understanding this mechanism is vital for effective control.
This deep dive reveals a striking paradox, doesn't it? The pursuit of maximal feed efficiency through aggressive particle size reduction can actually be economically counterproductive when the full hidden costs of gastric ulceration, everything from sudden mortality to insidious subclinical losses, are considered.
It forces you to rethink the equation.
What does this challenge mean for balancing efficient production with animal welfare and long-term sustainability in agriculture? How might we think differently about optimizing animal health and productivity in the face of such complex, multifactorial conditions?
Big questions. No easy answers there.
Definitely something to mull over until our next deep dive. Thanks for joining us.
My pleasure.